I'm Dr. Kim from Japan. The topic I'm going to cover today is the complications of CHD experienced in Japan. I'm going to express the whole data accumulated in so far. Okay? And first of all, I'm going to touch on the terminology. The complications means unwanted, unfavorable undevelopment of some kind of underlying disease or therapy. And adverse events is meaning is rather narrower, and that derives from the unwanted effects from the some drugs and medications, and including transcatheter intervention. So the word adverse events (AE) is the more appropriate to express the after transcatheter unwanted events, and we can express simply from now on as AEs. Okay, let us first talk about the population, because the study cohort is very important. You can see these three nations a gradual increase in national populations. So until 2013, in Japan, we have 127 million populations, and in Korea, around 50 million populations up to 2013. Okay? And we are having a declining the children population so far from our generation have given birth. And I think it is as well in Korea and Taiwan. And about this, my friend's country, for example, Malaysia and Vietnam has a larger population of children. And recently, I heard that some kind of regulation is for the birth rate is began in these two countries. And I have to move on to the study populations of the Japan. Yeah? So we have a JPIC society. So it is called the Japanese Pediatric Interventional Cardio Society for doing and performing pediatric and congenital heart intervention in Japan. So we have a very widespread institutions, about 90 to 100 institutions performing congenital and pediatric intervention, including rather high volume, mediumly high volume institutions doing performing 300 cases per year, and also very few cases who have very few cases or no cases enrolled in these institutions. And JPIC Society has 700 members, about 700 members in Japan. And let me show you briefly the history of development of JPIC Society. About 25 years ago, in 1990, JPIC Society was found, and in 1998, annual questionnaire surveillance for reporting on whole nation interventional cases and including the complication report is started. And in 2006, Untitled Chapter is introduced in Japan, and 2009, Untitled Chapter is introduced in Japan, and 2011, current executive board is started, and 2013, the next stage registry system, JPIC database is inaugurated. Okay, this is the current executives of the JPIC Society, President Dr. Tomira and two vice presidents, and we have two main committee in our JPIC Society. One is the board of committee of education, led by Dr. Yazaki, and the committee of investigation, and headed by myself. Okay, and from this year, two committees of board of new devices and editorial board is added in our society. Okay, according to the questionnaire, which began from the early and late 1998, we have collected this gradual increase in the whole cases in Japan. So until 2000, 2012, over 4,000 cases is reported annually. And annual questionnaire surveillance procedure is divided category in five categories. First is the balloon or atrial septostomy or something else, and valvoplasty of anything, for mainly pulmonary valvoplasty and aortic pulmonary valvoplasty, and angioplasties including balloon and cutting balloons and stent implantation, and occlusion procedure including coils and device closure, and especially the catheter ablation procedure is included in this questionnaire surveillance as one important category for pediatric and congenital intervention. Okay, so let me show you, display the results of the cases and the complication about these five categories respectively. So balloon atrial septostomy, including the traditional Ruskin procedure and other blade procedure, and static balloon procedure is included in this report. And until recently, about 250 and 300 cases per year is reported annually. Okay. And instance of the adverse events is reported in average 1.4%. And some mortality is reported like this. And let's move on to the valvoplasty. It's included aortic valvoplasty and pulmonary valvoplasty, and very rarely AV valve such as mitral valve valvoplasty. Okay, and this includes the PIVS and the critical pulmonary stenosis and postoperative and preoperative like this. Okay, and incidence rates of the adverse events is reported 3.8% generally. Okay, and mortality is like this. And let's move on to the angioplasty. And the stent implant is collected differently. Okay, so this includes the plain balloon angioplasty and cutting balloon angioplasty, and including the native and postoperative and pulmonary stenosis, branch stenosis, and coarctation of aorta, and PDA and shunt procedure, and great vein in stenosis and pulmonary vein stenosis, and less frequently percutaneous coronary intervention, mostly in Kawasaki disease, and the dilatation for a pre-implanted stent vessel is included. Okay. And we experienced a gradual increase, lots of intervention in this angioplasty, very close to the thousands of cases per year, and 1.9% instance of the adverse events is encountered. Okay. And mortality is like this. And let's talk about the stent procedure itself. And recently, around 100 cases per year is reported from Japan. Okay? And this includes various sites of stenting, and permanent stenosis, postoperative stenosis, and permanent stenosis of postoperative native and coarctation of the aorta. And the site is very identical as the balloon angioplasty. Okay? And the instance of the adverse events is rather higher, just 10%. Okay? The mortality is like this. And let's move on to the occlusion procedure, including a coil and device. Okay? And occlusion procedure includes a coil and device to the AP collateral like this blue bar, and AP fistula, including a coronary artery fistula, and a BD shunt procedure. And you can see right here, what do you think about this? This is the ASD Amplatzer occluder frequency. It began from the 2005, and PD Amplatzer is started from 2009 like this, and gradual decrease in the coil embolization of the PDA. Okay, and this blue bar, and look at this blue bar and this blue bar, and this shows the AP collateral frequency, and ASD occlusion cases. So these two cases is the most frequently experienced procedures in Japan. Okay, and instance of the adverse events of these occlusion procedures is about 2.5% in average. Okay, there's only one mortality here, and let's move on to the ablation procedure. This is limited in the radio frequency, not cryoablation so far, and it includes roughly AT, atrial tachycardia, and AVRT procedure, and AVNRT, and ventricular tachycardia, and intra-atrial reentry tachycardia, like this, okay? And we have over 36 cases per year in Japan, and very less instance of the adverse events in Japan, and mortality is only one due to myocardial infarction after the procedure. Okay? So in total, according to the 5 categories, we have instance of the adverse events like this. The most frequently experienced adverse events is in the stent implantation like this. So what do you think is the most risky and high instant adverse events procedure in detail? So in detail, PRVS and plus critical permanent stenosis in neonatal or early infancy period procedure is the highest instance and most risky procedures in Japan. So PRVS procedure and critical permanent stenosis is not so different. And it is more than around 50% like this. And also PDA coil occlusion is reported rather higher, 3.8%, rather than the 1.2% of the general instance of all the AEs. I think, personally, honestly, this is due to widespread performance in the Japanese various institutions. Okay, so we are going to classify the AEs precisely, and for example, PRVS, we encounter mostly, as you know, that the perforation and the tamponade is most experienced, and in stent implantation, migration is the most frequent, and procedure over 2 hours is accounted for AEs. Okay? And PDA coil embolization, you can see the migration is the most frequent, including the going to the surgery and unraveling, and over 2 hours fluoroscopy is like this. Okay? And this is the reporting system of the previous questionnaire surveillance. This is first reported by a paper basis and sent by the postal mail, and until recently it is reported by the Excel file by the email basis. And this is a blank, simple chart is for reporting the AEs. So to summarize the AEs, it is reported in text like this. So each Excel file is sent to my own individual email address, and surprisingly, I happen to know all the Japanese trends. Okay, so but this previous questionnaire surveillance system has significant limitations. So offline system and imperfect collection is not obligate, around 80 to 90% from all over Japan, and collected by to a single individual, and equivocal procedure classification and arbitrary definition of AEs, and not so much clearly defined, and age and gender is not registered, and so no link to registry and no link to other registry or certification system, and no regulation to secondary exploitation. That means secondary usage of the data. Okay, so I have more time, 2 minutes. Okay, so let me skip these new things. Okay, so I have to explain the data from JPEG and CBIT educational board, and this is different from the JPEG questionnaire system, and because this includes the CBIT data. CBIT means Japanese Association of Cardiovascular Intervention Therapeutic Association. It means adult cardiology. Okay, so according to the AMPLA septal occluder, like this, is increased like this, and surprisingly 60 institutions performing in Japan, and 81 operations we have until 2060. And until now, over 7,000 cases is completely registered in Japan, okay? And about 1/3 of the cases are done by CBIT procedures. And embolization and erosion incidence is almost identical from outside Japan, this. And to conclude my presentation, very recently we have the database on website online system like this, and this is based on the National Clinical Database. Includes a 13 registry system, okay, and this is system JPEG database system is constructed by this small 4 guys group, and this is connected to the Japanese surgical database system, and inside the National Clinical Database server. Okay, the reason why this database is has a link to the surgical database, because the postoperative intervention is very frequently encountered by for about half of patients. So vice versa, pediatric intervention cases also have a surgical case. So we are sharing the same patients. So fundamental database system is shared between the two surgical and interventional database. So this is, let me show you the actual input system, but we have limited time, so I'm going to skip this. So this shows the hierarchy selection system and no text system, and including the precise and the detailed adverse events, including the classification of the AE and timing of the AE, and what happened to after the AEs, and what kind of rescue was required after the happening of the AT. Okay, so according to one ASD ampla procedure, it requires 5 minutes, and postoperative procedure, postoperative case for intervention procedure requires about 10 minutes to complete this registration for each patient.
I'm afraid we need to.
Let me conclude this final summary. Okay, so this is the feature of the JPEG database system is just online registration system, improved collection rate, easy input system, and comprehensive rigorous classification, and including EP ablations and SHD interventions. And ethical consideration is prepared, and age, gender, and past history enrollment, and ability to link other registry or certification, and regulation for in the secondary exploitation or usage for the academic use and public use, such as introducing new devices for the government. Okay, that's it. Okay, 감사합니다 for your attention.